welcome everyone for coming. We have our wonderful panelist, our lecturer, Dr. Roxanne Carfora, who is very versed in women's health. She's a MD functional medicine and anti-aging doctor in Long Island at St. James. She's got a wonderful practice, Ageless MD in St. James. Dr. Carfora has been an expert with hormonal, working with hormones, bioidentical hormones, and nutritional counseling for men and women. She's been on, like she said, Channel 12, our local news stations a lot, and does lectures for a number of radio stations and TV stations. So with that, welcome, Dr. Carfora. I'm so glad that you would do this for us tonight.
Thank you, Jennifer. Great to be here.
So with that, we will get started. I have a presentation that I wanted to share with all of you. And here we go. It talks about Dr. Carfora and, you know, that she's an expert in hormones and nutritional supplements to better women's health. She's appeared on numerous talk shows and local news stations. And then here we get to the good stuff. So Dr. Carfora, can you just sort of help out, I guess, explain sort of this grid about when we experience the symptoms of menopause, starting with perimenopause and how and about that, and how we kind of know, is it creeping up on us? Is it there? Kind of take us to that.
Yes, so I call it the hormonal havoc. When we go through menopause, all of our hormones are upside down, inside out, and it makes us feel upside down and inside out, literally. And I'm sure most of you that are listening to this talk tonight have experienced a lot of symptoms. So they do start early. So people don't know that perimenopause, and I love this slide, Jennifer, so really nice. So people should take a picture of this, you know, just kind of, you know, take a snapshot, because this is you. This is you starting at 35 years old, and sometimes younger, depending upon if you have hormonal issues younger than 35. But as you can see from the first portion of this slide, 35 to 45 is when hormone decline starts. That's right, 35 to 45. Now, most women out there are starting their fertility years from 35 to 45, believe it or not. So they go into infertility clinics thinking they're infertile, but it's actually due to their hormones declining. The hormone that declines before 35 and 45 is progesterone. Progesterone is your calming hormone. It releases GABA in the brain, so it relaxes your mind. It enables you to sleep, and importantly, it increases your libido. So between 35 and 45, that one is declining. Also, progesterone is your backup for cortisol, your stress hormone. So when a woman gets very stressed between 35 and 45, and I'm not just talking emotional stress, I'm talking environmental, emotional, and physical. And the physical is the decline of hormones. So your progesterone drops, and you will experience rapid heart rates, irritability. I call it the barking dog. This is the one that just like, everything, person just barks at anything, right? And they're just very irritable and anxious, and they bitch and moan to everyone. Okay, and then when their cycle goes through their cycle and their progesterone comes back a little bit, they're sweet as pie. And they're saying, oh, let's go out to dinner. But meanwhile, they just yelled at their family, their children. So this is a really real issue. And also between 35 and 45, progesterone is a real issue for postpartum depression. Since women are having babies later, and they're having babies later with lower progesterone, which makes them more infertile if they don't have enough progesterone. So they become, after pregnancy, that progesterone goes really way down, and they become sad, they become irritable, they become withdrawn. So that's your 35 to 45. So Jennifer, you want me to continue through, or does anyone have questions between 35 and 45?
You know what, we'll kind of address that, I guess, at the end, because everybody is muted right now.
Okay, perfect. So write your questions down. I'm here to answer them. Okay.
If you have any questions, put them in the chat, and then we'll get to a question and answer period at the end of Dr. Carfora's presentation, and we can get all the questions answered at that time.
And we are doing this seminar for you. Okay, MD Logic, Jennifer worked hard bringing this on board, so please feel free to ask questions, take advantage of it. So the second part, so 35 to 45 progesterone starts to drop. And we just spoke about postpartum depression, how your stress hormone also pulls down progesterone, and often you'll wind up with these symptoms that are on the board. Then from 45 to 55 is when estrogen starts to drop. So estrogen, there's a slide after this, which I'm going to go into detail with estrogen, but estrogen starts to decline along with progesterone. Now, where you could get into trouble, if you are a woman that is estrogen dominant, which means throughout your lifetime, from when you were 35 to 45 or 35 to 50, and you were diagnosed with fibroid uterus, heavy menstrual bleeding, fibrocystic breast, you were extremely low in progesterone and very high in estrogen. And I call estrogen the itchy, witchy, bitchy hormone. So as that changes, you actually get like you can't sit still, you get bitchy, you get anxious, and again, you get very irritable. So that's estrogen. And there's also increases in other things cardiovascular-wise. So 45 to 55. Now, what I do as a functional medicine anti-aging doctor is that I catch all of you when you're 30 to 45, because I don't want you to be miserable with progesterone and develop all these symptoms. I don't want you to go through this where you have estrogen sky high and progesterone very low, because that could be damaging to you and to your system. So you have to bring these hormones together down, okay? You don't want one higher than the other. It's all about balance. We've talked about this in anti-aging medicine since the late 1990s. I have actually been doing this since 1998, and board certification occurred in 2004. So we've been doing this a long time, anti-aging and functional medicine. So again, you want to catch yourself early. Then from 55 to 65, man, you're losing it all. And I'm 60 years old. I am not losing my hormones, honestly. My hormones are from my brain. I feel very balanced. All right, my family may say something different, but let's keep it to ourselves, fam. Because sometimes progesterone does go low, but from 55 to 65, again, your hormones are declining, in particularly progesterone, estrogen, testosterone. Okay, you start to lose testosterone, which is really important for bone health, along with estrogen. You start to decline in cortisol, your stress hormone. So you're not able to deal with stresses from age 55 to 65. And that's where we get illnesses and things like that come into play. So again, your whole life, you're going through hormonal changes, hormonal imbalances, and it's important for you to know your hormone levels, know your body, know your cells, as I always say and preach it, and know what you're dealing with. So then every 3 to 4 months, you could do your check and balances, and you could avoid certain illnesses related to hormonal decline. And we didn't go before age 35, but we start to menstruate around our 14, 15 years old, sometimes even earlier now, because our foods have a lot of estrogen in it. So we're getting 10, 11-year-olds that are having menstrual cycle, and they're becoming estrogen dominant. So during that time, from your menstrual cycle up to 35, again, important to recognize if you're an estrogen dominant person. And if you are, you will experience heavy bleeding, you will experience extreme cramps, and these things lead to endometriosis. Endometriosis is an estrogen dominant disease. So, you know, listen to your daughters and things that are talking about my period is heavy, mom, my breasts are tender. These are kind of signs to say, you know what, let's get your hormones checked. Give it to you, Jen.
All right. Well, actually, here's our next slide about the estrogen hormone level. But one of the questions which we're going to touch on here that had come up was, does blood work always show hormonal imbalance, especially during pre-menopause?
Yes.
Perimenopause.
Yes.
So, you know,
yes.
and I think that ties into what we're going to talk about now.
Yes. So you can check your hormone blood levels at any time. Later on, when we do hormonal replacement therapy, we just go by symptoms with estrogen. So that's a different story. For example, I had a 14-year-old today with a very sky-high estrogen level, which we have to balance, right? Because if we don't balance that, that girl is going to be in trouble. She's going to get heavy bleeding. She's going to get endometriosis. She's going to get fibrocystic breast. She's already losing her hair from high estrogen. So this is really important to catch it at an early age. So great slide again, Jennifer, to look at estrogen. Now, real important, women, men, everyone out there, because men have estrogen. Okay, I'm just adding that in because men's health is very important too, as well as women's health. We like to balance both people, right? So men have estrogen as well. So estrogen has over 400 functions in the body. Okay, 400. So when someone tells you don't need estrogen, well, I'm not going to lose my 400 functions. And this has been heavily studied. This is no hokey pokey medicine. This is heavily studied. It's been in Italy for over 75 years. I keep on saying 65, but it's been the 10 years since they've released the studies. But we've had, the studies in America for probably close to 16 years. So estrogen is a very important molecule. Again, over 400 functions in the body. We'll start from the head down. So eyes, okay, dry eyes, vision loss is estrogen. Taste and smell, loss of taste and smell, similar to COVID, right? We get all this COVID stuff, but estrogen causes that decline. So if you're a woman who has estrogen decline plus COVID, okay, you're going to lose your sense of smell and taste, okay? Going down to the throat, thyroid function, skin. Estrogen is great for skin, right? So it gives you moisture, it makes you hydrated. Heart function. Okay, going in from the heart. Gut, as your estrogen drops, your good bacteria in your gut drops. So we check that on blood work, we check that through biocommunication systems, and we get data on you to see exactly what you need. Don't just take anything. It's very specific. So get your data so you can be specific with what your body needs, because it's very different than what the person next to you needs, genetically and everything. So individualized, personalized care is the way to go. So, and going down into bones. So estrogen, very important for bone. I call estrogen the truck, right? The truck brings in the calcium. The D pushes it in. But if you don't have the truck, you're not bringing that calcium and D into your bone. So you will develop osteoporosis. It's just a matter of when. Okay, and this is studies galore. So if you want to look at studies, you could go on PubMed and look at all the studies on estrogen. So looking at it from 20 to 80 years old, nice slide because it like color codes it. So we talked a little bit about how estrogen, when a woman menstruates, how estrogen is one of the first molecules that goes up, and it could become dominant if your progesterone and other hormones aren't following. And it also has to do with your stresses in life. So you take a young girl that is very stressed, her hormones are going to be totally different than a young woman that is in a very calm society or calm environment. So looking at, so from 20 to 30, again, hormones go up. From 30 to 35 is like peak hormones. That's why we should have babies between ages 25 and 35 because we're most fertile. Okay, after 35, fertility goes down. And fertility goes down because of, we spoke about another hormone, progesterone. Remember, progesterone goes down between 35 and 45. So as progesterone goes down, what happens to estrogen? It becomes dominant. So 35 to 45 is where we will see fibroid uteruses, fibrocystic breast lesions if you have this, okay? And the goal is to fix this. Now from 45 to 55, estrogen again declines. So your sense of smell, your sense of taste, your vision starts to change from your 45 to 55. You need glasses, okay? Nothing that we could, even estrogen, bioidentical estrogens, I still just have to wear readers, but I don't have to wear anything else. So again, your vision declines, your bones decline. So again, 45 to 55, get checked for osteoporosis, all hormonally related. Okay, so, and there are so many natural things. I love MD Logic, that's no secret. I was involved from the beginning when the company was formed. I was involved in formulations, and we made incredible formulas that I have been using in my practice and been studying. I get the data on the blood work. I get the data on to see in the biocommunication system, are these things working for you? And they are working. So it's really important to intervene with nutritional therapy, knowing your levels, getting your blood work, knowing your levels, and then intervene with whatever you need, either naturally or bioidentical hormones from 45 to 55. And then again, 55 to 65, now you're really losing estrogen. And cardiovascularly, your heart needs estrogen. And if it doesn't have estrogen, that's when you get arrhythmias, you could get cardiovascular disease, brain health, real important. People get forgetful during that time, 55 to 65, again, estrogen coming down. There's over 400 functions in the body, and memory is key. So estrogen decline causes memory depletion. And I have cases, online years ago, lecturing in reference to this, and through the years lecturing to this, about this, and women saying, oh my God, like I really lost my memory. I was a teacher and I couldn't, calculate, and I couldn't do my math with my kids anymore. And I always was great at it, but I can't remember. And they go to the neurologist, and the neurologist says, well, maybe it's early Alzheimer, but maybe it's, low estrogen. So, get your estrogen checked. Now from 65 all the way up to 80, again, decline. My oldest patient today on hormonal therapy is 88. She will not go off her hormones. Okay. My oldest living person just turned 106. An Italian woman that could dance around circles around anyone. And it's all about that they kept themselves balanced through life. I'm doing this for 30, I don't even want to say 35 years now. I mean, it's crazy, but doing this for so long and having my patients that they started with me when they were 45 to 55. And now that 45 to 55-year-old is 85 to 90 years old. So I look at that and go, wow, they look great, because they kept their vitamin D levels, they kept their nutrients up, they kept their hormones balanced. So again, really important. Love this slide. Again, you should take a picture of it so you can see, look at your estrogen declining over the years.
That's great. Dr. Carfora, you and I had spoken about something earlier about if a woman is sort of brought into early menopause through a hysterectomy or some drug interactions that have kind of caused their body to just sort of go into, early menopause with a drug interaction from something else that they're dealing with. But for the hysterectomy, people sort of who have had maybe sort of hysterectomy in their 40s and now are in their, mid 50s, what do they sort of need to be aware of in terms of their levels, and have their bodies stop producing hormones altogether? I would think that they have.
Great question. So the first thing is, why did you have a hysterectomy, right? So we just spoke about estrogen dominance. So a woman will get a fibroid uterus, bleed heavily with estrogen dominance. So we want to avoid that. That woman commonly also has fibrocystic or breast issues, breast cancer. Okay, we see cancer in that the years that your estrogen is high, progesterone's low, 35 to 45, right? And then all of a sudden you're getting this, and you're getting other factors involved there. But the damage already happens when you were estrogen dominant from 35 to 45, and then you needed your uterus out at 45 because you were bleeding and losing blood. That's the bottom line. So the reason, you say, why? Why'd I have my uterus out? Okay, I'm estrogen dominant. You get your uterus out, you're still estrogen dominant. So you still have estrogen floating in your blood looking for a place to park itself. And where's it going to park? It doesn't have your uterus, right? So it's going to park in your breast and fat tissue. And that's when women post hysterectomy, they don't have the uterus. Again, the estrogen is going to go here. So they get bigger breasts, or they get problems with the breast, and they get the tire around the bottom. So they gain weight because estrogen is a storage molecule. It loves to store fat, and that's where it goes. It decides to, I'm going to, plant myself here. So again, you're still estrogen dominant. So you still need to get your levels done. Just because you have your uterus out and you stop bleeding, you're still affecting organs, you're still affecting breasts, you're still affecting cardiovascular, because if your estrogen is very high, you could get blood clots. And now we're talking, okay, everyone get the COVID vaccine. Okay, what's your estrogen level? My patients, high estrogen, they're not getting that vaccine because they're already at risk for a clot. So, you know, you have to look at these things, and it's so important as women, because this is our bodies. All of us go through this. Not one of us listening and not one of us here commentating this have not gone through hormonal havoc. So get your level checked, because you're still estrogen dominant. You could still get the effects of estrogen dominance, which could be, you know, devastating.
Next slide. And then we have here what we left out earlier with all the symptoms of menopause that we all sort of go through, like you said, from an early on, that you sort of don't understand why it's happening, but there it is. Everything from anxiety to the dreaded weight gain to fatigue, insomnia. I know I have insomnia a lot sometimes, or just don't sleep as well, feel exhausted in the morning, headaches, you know, the hot flashes, of course. So how can we sort of manage these on a daily basis to be a little bit more comfortable in our skin, so to speak, other than taking hormonal therapy? Some people might not need that, or they may not want to start it right away, but naturally, is there a way that we can kind of, I guess, work, you know, and get some relief from some of these symptoms?
Absolutely. So the first thing is hormones have to bathe in the perfect broth. If your broth is not good, which is your blood supply and your nutrients, your hormones aren't going to work. So the first thing is always, always, always food first. Dietary is so important. So you must be eating more vegetables. Vegetables alkalinate the body's pH. Hormones only work in an alkaline environment. So if you're a person that is eating a lot of white bread, white starches, and a lot of the sugary stuff, that equals acid. Hormones do not work in an acidic environment. So please eat lean, chicken, fish, turkey, lots of vegetables. If you could be good 80% of the time, have 80% of your plate being vegetables and eating lean and green and drinking water, and please get rid of soda. Soda companies do not like me, because we've been preaching this for a long time, but please get rid of soda. And they've gotten, I won't mention companies, but everyone knows, when you look out there, these companies now make carbonated water, because they know the realization is we have to alkalinate the body. They know the science, they know the data. So we have to change that kind of mindset. So food first. If you can't get these things in food, then supplement. Now for menopause, we have a lot of great stuff, beautiful slide. Beautiful. So this is lean and green, right? Lean, green, nuts and seeds, right? This is the way everyone should be eating. So you could put these, if you can't eat this and you're not the person that could eat well, again, that's when you take supplements. So that's when I'll use, like if someone has a cortisol issue, I'll use adrenal balance, because again, you have to balance your cortisol, especially when your progesterone between 35 and 45 is going down, right? And then we could use like menopausal formulas that have like a little bit of like yam in it, or a little bit of chasteberry. These are things, beautiful. So these are things that are in the menopausal complete. So what this is, if you look at the ingredients, the soy isoflavonoids is giving you plant estrogen, so it will balance that. The black cohosh is more, and Don Quay is more for hot flashing and water retention. We all get water retention because it affects, it's a stressor on the body. Menopause is a stress on the body. So when your body is stressed, it retains water, okay? Chasteberry. So the chasteberry is your progesterone. I love chasteberry because like, and someone who's like 30 to 40 years old going through something, they don't want to go on hormones, obviously, and they want to try to think, again, want to try something, we do diet first and then supplement second, right? The red clover, sage leaf, and the red raspberry, all high antioxidants. So it helps detoxify the body as you're taking this for your estrogen progesterone balance. And your licorice is adrenal balance, which is very important. Again, cortisol will pull down that progesterone, especially between ages of 35 and 45. Life is stressful. So your progesterone is going to go down. You're going to get palpitations, irritability, can't sleep, you know, can't think, have low libido. That's your progesterone. And if, Jennifer, could you go back to that slide with the symptoms of menopause?
Yes.
Can you go back one?
Yep. Mm-hmm.
Okay, so when you look at this slide, take a picture of this also. And I'm going to go down these symptoms real fast and just tell you what you're depleted in, okay? So number one, anxiety equals progesterone. Depression equals progesterone. Headaches equal progesterone and estrogen. Decreased libido. Now this is going later on. You have decreased progesterone, vaginal dryness, which is decreased estrogen. That vaginal dryness decreases libido, and you have low testosterone. Fatigue, because this 1, 2, 3, 4 is such a stressor on your body, fatigue is adrenals. And that's where I pull in adrenal balance. So right now, this woman, just based on the 1, 2, 3, 4, 5, is on a menopausal formula and adrenal balance, okay? Insomnia is progesterone. Okay, insomnia is unbelievable. People come in, they think they have sleep disorders and they can't sleep, they're tossing and turning. So progesterone and adrenals work together there. So often when we correct adrenals naturally, the insomnia gets better. Now moving over to the right side, your hot flashes are estrogen. Your irritability is low progesterone and low estrogen. Your weight gain is storage of estrogen in an estrogen dominant woman. Very important. Storage of estrogen in an estrogen dominant woman. That puts major stress on the body and your adrenals crash and you start to gain weight. Osteoporosis. Osteoporosis is your estrogen. Remember the truck. The testosterone is the driver that has to bring them in. So you've got the driver, which is the testosterone, bringing it into the bone, the calcium and the magnesium and all the good stuff for bone. And then you have your estrogen, which is the truck. Okay, so you need both testosterone and estrogen. Progesterone kind of balances it. Your memory lapses, all estrogen. Man, is it all estrogen. Women that go on estrogen that have like really seriously memory losses and stuff, they go on estrogen, they feel incredible. Even their friends go, oh, wow, you used to be forgetful. You know, wow, you're pretty sharp now and, you know, witty and stuff like that. And then vaginal dryness is estrogen, estrogen, estrogen. Now, for women who have breast cancer, we use testosterone. Okay. So, and again, this is all hormonal right here. So you may go, okay, I have anxiety. Let me take some Xanax. I have depression. I went to my doctor. They put me on an SSRI. I have a headache and they gave me some headache migraine medicine. I have decreased libido. They said, oh, that's normal. Don't worry about that. It's all part of menopause. I have fatigue. They go, you know what? See a psychiatrist because fatigue and tiredness, that's a woman's disease. You have insomnia? Oh, go take a pill. You know, take a little something that you could go to sleep with. How about a little bit of warm milk? You have hot flashes? Just go through it. Don't worry. Just go through it. It'll take you 5 to 7 years, but you'll get through it. You got irritability, so what? You yell and scream at your kids and you get a divorce 3 years later. Weight gain, lady, go to Weight Watchers. Osteoporosis, I'm telling you, this is what I get in my office where people come in, they go, this is what these people told them. Okay, osteoporosis, you know what? Maybe we should send you to get some Prolia and stuff, which is a great drug, Prolia. But what about preventing osteoporosis? Memory lapses, go see the neurologist. We think you have Alzheimer's. And vaginal dryness, suck it up. Okay, go get some Replens over the counter. And that's the bottom line. And honestly, you don't have to suck it up. You don't have to see multiple specialists. You don't have to, you know, go to see a psychiatrist and go on medication for anxiety and depression. You have to know your hormone levels, get them checked and start addressing them.
It all starts there. So true. I mean, I've gone through it myself where, you know, with the weight gain and, you know, oh, well, you know, don't eat so much when you barely eat at all. And, you know, oh, you're tired. Well, just deal with it, you know, just kind of get through it. So, and I think we can all sort of agree that we've been through that with some of the health professionals in the past here and there, that it's just, you know, basically they just feel that menopause is something we just have to deal with. And if we're unhappy, so be it, like you said, for the 5 to 7 or 10 years. But actually thank you so much for your questions. We have really great questions, so keep them coming in. But getting back to your blood levels and having them checked, how could I guess some of the participants go to their health professional, what should they ask for if they want to have their levels
Yeah.
checked in form of a
Yeah,
blood test?
the health professional, if they're just a generalized medical practice, they won't order it because they don't know how to handle it. So you really do need to see an anti-aging functional medicine doctor to do this. And you could tell them to get your FSH, they'll do your FSH or LH, and they might do your estrogen level. And if they do progesterone, it's more for infertility. So majority of the time, they're not going to do it. But you could get them checked, you could ask. You could say, can I have my testosterone level done, my progesterone level? They're going to say, we don't do that or whatever. And a lot of these, general medicine, I'm general medicine, I'm family medicine, anti-aging and functional medicine, trained in all three. But a lot today is hospital-based, large groups, management companies. It's just not going to happen. This falls under more personalized, individualized care.
Right. Well, this is why we're sort of bringing some information to everyone to try to sort of help them along and give them a forum to, learn about it and see how they can kind of work with their challenges. Another question was, what if you had your ovaries removed as well? I guess getting back to some concerns of what to kind of, look for.
Yeah. So with your ovaries out, you have nothing. You have no progesterone. You have no estrogen. You probably have limited testosterone. There is a little bit of estrogen, progesterone produced, believe it or not, in the intestinal cells. Very little, not enough, to sustain your other cells in your body, such as your brain and all of the other things, from taste to swallow to, stomach to heart to skin to joints to osteoporosis. So yeah, you really need, you're going to need some hormonal replacement therapy or herbs that, that are on the board right here. I love it.
Yeah.
I love these herbs.
This is just going back to what you spoke to earlier with some of the more herbal remedies for some of the menopausal symptoms that we sort of all face and exactly what each of them does. So I have been experiencing it myself. I actually have tried various forms of these blends and formulations. That's why I'm very excited about the one that we had that I started testing out. So, which I think you'll be, really good because some of these really do help. Nothing is going to make them go away totally or cure it, but it will help you sort of feel more like yourself and, have a little bit of a pep in your step throughout the day. So I think that's important.
Absolutely. And blending this, even if you're on bioidentical hormones or hormonal therapy, or you're using estrogen creams for vaginal dryness, these herbs balance the hormones that you're getting. So it's nice to kind of blend the both of them if you need to. Again, we always say food first, supplement second. This is an awesome supplement. I'm just as excited as you because
Right.
it's so exhausting for women to go, okay, I need licorice. I have to take chasteberry. I have to take, and then you wind up taking like 5 pills. When,
Right.
MD Logic, the scientists behind MD Logic are incredible. And they really listen to what a physician needs to say to them and what the public needs to say to them. Say, I need this, I want this. Just a quick story just about the company itself. MD Logic as a company, when COVID hit, and I said, we need something with zinc, vitamin C in a lozenge, because I wanted to get it into them to prevent the spike protein from getting into the lung and the tongue. I said, I need a zinc or vitamin C lozenge. And they developed an immunologic thing that boosts up your immune system. I don't have not one long hauler in this practice. And I truly owe it to the quickness of the scientists behind MD Logic and getting it to my table within 2 weeks. I mean, my patients, I truly believe, were saved.
That was a great addition. I mean, that immunologic capsule itself had zinc, vitamin C, and vitamin D3, which were the big, the big 3, and it really worked.
And
it really did.
Yeah, which quercetin decreases all the inflammation from COVID. And I put it in a protocol, and people actually were like, they wanted the protocol. And now it comes to, see all of the data coming out. Everything that we needed was in there. And that's what I just love about this. Everything you need for your menopausal symptoms and relief is in this product. Amazing.
Right. Which is great, because like you said, to have to go and source out each individual thing. I mean, as it is, some of us are maybe taking a vitamin D because our levels aren't quite what they need to be, or, vitamin C and things like that. So to have all of this in one pill is fantastic, because you're taking less, on a daily basis that you need to take. I have a question from a panelist that actually has taken our adrenal balance and likes it, and very happy about the Menopause Complete. But the question is, when should it be taken, in the morning or the evening? Because there's 2 capsules, the dosage is 2 capsules a day. So when do you recommend taking them?
For the menopausal?
For the Menopausal Complete.
Okay, so with adrenal, take your adrenal in the morning when you get up and around 12 noon. You want the adrenal morning and afternoon. That's how I do it in anti-aging and funk med for years, and it works because you want to keep your adrenals up. With this formula, from looking at the formula, and I know they say take two in the morning, I like giving it to the patients 1 in the morning, 1 at night.
For the Menopause Complete?
For the Menopause Complete.
Okay.
I like doing morning and night because the products that are in here are balancing not only the fluid retention and hot flashing, but it's also balancing the adrenals a little bit with the licorice, and I like that. Now, if you find it keeps you up at night, so say you're taking 1 and 1, and at night you go, oh no, this is keeping me up, then take it with the adrenal balance in the morning, 8 a.m. and 12, or 12, 1 o'clock. So now you have the boosting effect of your adrenals in this menopausal formula, but also you have the hot flashing during the day. That's under control.
Great. And also the question was, the person was diagnosed with osteoporosis. So at this point, what do you sort of suggest, I guess, for that?
Well, it definitely depends upon your age. I would get your blood levels checked for your hormones. So testosterone, progesterone, and estrogen. Get that checked. Also get your vitamin D checked. Get your calcium and your magnesium checked. And I'd have to look at, I as a physician like to know what the bone density is, what's your negative score, your T-score, because if it's really high and you are at risk, for a fracture, then you need to build that bone up with medicine. Not all medicine's bad. So it depends upon the severity of your osteoporosis, and remember, always be alkaline. The thing with osteoporosis, if you drink a lot of coffee, right, which a lot of people that exercise do, they like their coffee, and they'll drink like 5, 6, Starbucks. The Starbucks is right across from me. The line is always around the block all day long. And I'll come out of my office and look out front and go, geez, there's a line still there? I'm here from 8 o'clock to like 7 at night, and there's still a line there. If I went out there now, there's still a line. So coffee makes your body acidic. So you decrease absorption. So over a period of time, if you're eating a lot of starches and stuff like that, and your body's acidic, your body's amazing because your bone is stored calcium. So calcium is a buffer. It's like kind of when you put, get the algae out of your pool and you put substances in it to clear it up, right? So it's a buffer. So it brings your acidic diet brings the calcium into your circulation to just balance it, to pH balance. So diet is real important. Second, I love this, the bone builder. So bone builder with your vitamin D in there and boron, that brings all of that into it. So you use all of that in there, which is, again, a truck of nutrients, I'm going to say, right? So it's got the driver, it's got the truck, it's got the bricks. It's bringing it all into the bone to make it build up. And you got the K2 that kind of likes to hop along and fill up the gas tank, right? These aren't electrical vehicles, right? We need gas. So we got to push them in. So, push it into the cell. So K2 is the pusher, right? It comes on, it goes, come on, vitamin D, let's push this truck loaded with great calcium and magnesium and boron, and let's get it into the bone. But hey, person, you better start eating apple and fruits and vegetables and take your multi, And again, scientists did a great job on this too. They have a wholesome women's vitamin, which I take it myself. I love it. Love it. It's got everything in it. It's got your fruits and vegetables. It's got everything in it to balance you. So all of this together, great formulations.
And also getting back just a comment about the multi, which is one of my favorites that I started taking way before I even joined the company, but is that it's fermented, the multivitamin. So
Yes.
That's important. Can you just get into a little bit about why fermentation is important with the vitamins?
Yeah, so just really important with the multi too, I like that it's pressed, right? So it has fruits and vegetables. I call it the 5-in-1 vitamin. It has your fruits and vegetables. It has your vitamin D. It's got your methylated Bs. I mean, these are not like, dirty. These are clean, like clean nutrients, and they are grown for great products. And I've been in the facility of MD Logic. They test these things when they come in. So your raw materials are tested. And believe me, if they have 1 little ounce of any contaminant, it's out the door. It doesn't even come in to the facility. I mean, this is strict guidelines. They have a lot of pride in what they made, and it's made on Long Island. So, support your Long Islanders just as a business in itself. But yeah, so the fermentation process of it just makes it easily absorbable into your body. The purity of the products that are coming in, the raw materials, again, they're cleaner than clean. So that's what you want to put in your body. You want to put clean substances. The capsules, gluten-free, dairy-free, most of them, everything. And the other thing is that some of the products too are chewable, which, some people, they go, oh, I can't take vitamin D, but I have them chew that D. And then they just take that little piece of vegetable cap out. So there's a lot of good positiveness of these products. Yeah.
Yeah, and the Immunologic has some garlic extract in it, and it tastes like you have a little Italian salad going on in your mouth when you take it.
Because of the oregano.
Yeah,
the oregano is just. I mean, I really and I'm not saying this. I don't put my name on anything, but being involved from day one and sitting down at a table and going, okay, there's all these products out there, but they don't work. They don't do this. We want the purest of the pure, the best of the best, and something that I'm going to take and give to my family. And the scientists are phenomenal. So thank you, scientists at MD Logic, because they work their tails off.
Well, we have another question that has come in. How do you exercise /eat/supplement to regain muscle tone lost to menopause?
Oh yeah, testosterone.
If they push too hard, later they get more bloated and have heavy legs.
Yeah. Well, you need testosterone. So you should get your testosterone level checked. And the product that produces testosterone is called DHEA, not DHA, like that's fish oil. DHEA. And I use DHEA a lot in perimenopausal women because the DHEA 25 milligrams a day will boost up your estrogen, progesterone, testosterone really naturally. And often I'll use that in combination with the menopausal formula, to help with not only boosting up levels, but also balancing those hot flashes and vaginal dryness and all that. But you need testosterone, and you need to protect those bones. So make sure you know your D, make sure you know your levels, your calcium, your magnesium, and if they're not good, start supplementing if you can't get in dietary.
And the vitamin D level, I mean, that's something simple. If you go into your primary care physician and just for a checkup and they're running your cholesterol, and you can just ask them, hey, check my vitamin D, right? Like that is one that they'll kind of add on, because I know friends who have done that, because I say to them, oh, you're having your blood work, have them run your vitamin D. They're not going to do it unless you ask. And they did. And then they found out, they said, hey, my vitamin D is low.
Yep.
Like, yeah.
So vitamin D, for years, and I'm going to quote and unquote myself, vitamin D is key. Vitamin D is key. Vitamin D is key. I dance around the office, I go, vitamin D is key. Because your vitamin D is your immune system. It increases, again, your calcium and magnesium absorption into the bone. It works as a pro-hormone to balance your estrogen, progesterone, testosterone. I mean, this is no joke, this little baby. And it increases your immune system, right? So this whole thing with COVID, you take all the people, the darker your skin, the lower your vitamin D is going to be. So you take all the dark-skinned people that unfortunately got COVID, I would love to know what their vitamin D level is. It's as simple as that. So get your vitamin D level checked, and it should be between 50 and 70. And even if you're an 80, it's okay. That's even better. You know, you just don't want to be like 90, over 90, and definitely you don't want to be less than 50. And most people, their levels are at a 25. And I've had my dark-skinned patients, the lowest one I had was a 4. She was a 4.
Interesting.
When she came in. So, you know.
And I know in terms of the vitamin D3 supplements themselves, in addition, I know that ours has like 1,600 IUs in the multi itself. But
Yes.
then if you need to supplement more, there's like ours go from like 4,000 to 5,000 IUs. Is there kind of a number that you are looking to stay within if you are going to add supplemental vitamin D?
Oh, yeah. That I was so excited when the scientists said, oh yeah, we could do 1,500 in here, because that's basically everyone should be on at least that. That's bare minimum.
Yeah.
At least that's if your level is up to like 70 or 50 to 70 and you just need maintenance now. So that multivitamin gives you just enough for maintenance. But most people still need 5,000 IUs a day. Most. So and that's why you get your levels checked. You do the 5,000, you know, daily until your level is up to about a 50 to a 60. And then you go, all right, let me see how I'll do Monday, Wednesday, Friday, you know? And then if it plummets down, you got to stay on 5,000 a day.
A participant had a question about calcium, sort of calcium with the K2 and other ingredients causing constipation. Does calcium usually cause constipation, or is it a mix of the magnesium and the calcium and the K2, things like that?
Yeah, the mag helps you. The combination will help you, and the vitamin D. So the D, the K, and the magnesium will help move your bowels. Calcium should not be constipating. If you're taking calcium and you're constipated, you're dehydrated. Calcium should not do constipation.
But the addition of the vitamin D3 in there should help with that.
Oh yeah, and the mag. Yep.
Great questions. Just trying to see. Oh, here we go. I've been hearing a lot about bone broth to help us with anti-aging. Yes, that is a big topic, and collagen loss. Do you have any feedback about that?
Yeah. How much bone broth can you drink? I'm sorry, I tried it myself, so maybe I'm the wrong person to ask. But man, you'd have to be sucking down that every day. I'm sorry to say. And it's not the most nice tasting thing, even if you put like vegetables, which I love. If you take bone broth and you make a nice vegetable soup, boy, that's nice, lean and green. But it's tough. Bone broth is good, but you know, where's it coming from, first of all? You know, what carcass bone is it coming from? That's what always bothered me. You know, is it from a grass-fed cow? Is it from a chicken? Is it from, like, you really have to know what bone broth you're buying too, you know? So think about it. It's bone broth. So it's from the bone marrow of an animal. So I'm not too thrilled with that, and my patients know that. So they're like, but it's good for you. I go, okay, but if you could take it, I'm just telling you, I don't see it so beneficial.
So I have another question. Oh, okay, here we go. What about iron supplements for anemia? Do you have any kind of feedback on that, or what to do about that?
Yeah, so, know your source of anemia, please. Like, just don't take iron when you don't know the source of it. So the source of anemia is either vaginal bleeding or you have a colon polyp. So anyone with anemia or iron deficiency anemia must get a colonoscopy and must make sure the uterus and everything else is good. Because again, I always rule that out before putting someone on iron supplementation. So yeah, you could, eat iron-rich foods. Lots of greens, green leafy, so people know that. And you could add iron supplements. I give people 6 weeks. If that iron doesn't go up in 6 weeks, they're going for a colonoscopy.
Oh, good to know. So 6 weeks is sort of the sweet spot in terms of figuring out if it's helping.
Yes.
Okay, great. Well, I don't see any other questions, but these are some great questions, some great dialogue. And I think that, some of the information that we received today regarding, sort of what to look out for, especially like you said, like 30, 35 to 40, which that's important because I think people don't realize, they just think, oh, I'm okay. But again, there's that whole estrogen thing, and estrogen dominance is very interesting because I think a lot of people go through that and they're very unaware. So, and I think also different forms of birth control and things like that over the years sort of fluctuate a lot with your hormones or, different reactions, which I don't think people sort of understand or know what's happening. Would you care to, because I also read something recently about oral contraceptives can cause big nutritional depletions or deficiencies.
Yeah.
So do you find a lot of that with your patients?
Yeah, so I mean, birth control pills, I always check their pathways to see if they genetically can metabolize their estrogen and if they're missing something. So anyone who's going to commit to birth control pills, again, know your pathways. And that's what we check, and we make sure that you're good before, because there's certain genetic factors that interfere with estrogen metabolism as well, and what I find very interesting is that birth control pills were never studied before they were released. They were just released. It still bothers me, even though it was done in the late 1960s or whatever. Still bothers me. They just released it. Here, women, stop birth. It's just so, just know your levels, know your metabolism, know your genetics. And that's what we do here. And that's what I've done my whole career, and just keeping people well and really educated so you know what your body needs.
Well, I have a question regarding, skin, I think is a big thing, especially as we age, and sort of how, what we're deficient in and things like that. So in terms of kind of keeping our skin as healthy as our body, what do you sort of suggest sort of how to handle that? I know sort of certain vitamin C people say, and certain vitamins will help with that on a daily intake, just to kind of help, keep our skin as fresh as we could, want it to be.
Yes, so remember, skin comes from within. So everything counts that you put in your mouth, everything counts that you put on your body. And that's, the skin. And know again your vitamin C level, your vitamin D level, your vitamin E level. These are all antioxidants that help with skin replenishment. And your collagen actually starts to decline when you're 21 years old. So you're actually aging at 21. Well, they always say in anti-aging medicine, we do have a saying that you're aging the day you were born. And that's true, right? Think about it. You're a day old, you're 2 days old, you're aging, right? But 21 years old, you're starting to lose collagen. And what's important, Jennifer, and this is another thing that I love, about the scientists behind MD Logic. Again, thank you for all that you've done, because they take collagen and they put the C in it, they put the hyaluronic acid in it, and they put the biotin in it. All, to me, as an anti-aging doctor, is like the big pow, great for the skin. So, at 21, start considering, putting yourself on some collagen powder, and make sure that it has the hyaluronic, the C, and the biotin in it. So you're feeding yourself this. And you could add it to coffee. My patients, they love like mocha flavored, and they go across the street, they get their Starbucks, they come in, put their little thing, shake it up, and they're sitting here drinking their coffee with collagen in it. So yeah, it's important. And then the external factors, so, we have everyone good from within, the skin, again, reflection from within, supplementing with collagen when you're 21 years old or so, looking at all your levels that feed the skin, and then doing laser facial rejuvenation if you need that. I have young people that come in here and they started at 28 years old, and they'll go for facial rejuvenation. If you have acne, you could do facial rejuvenation with laser. Laser is awesome for acne. No young adult should be suffering with acne today. None, not one. So there's so many things that you could do to correct that, and it truly does make a difference.
Great. I have one last question before we go that just came in, which is important. What about a young woman who has polycystic ovarian syndrome?
PCOS, boy, I spent years lecturing about that, really years. So PCOS, the first thing you must is dietary. Now we call it the 3 Ps, right? PCOS is paleo diet. So getting rid of all the white flour, all the stuff, right? So we used to use paleo years ago. Now we do Whole30. So Whole30 gives you more, and you can look this up online. Whole30 diet gives you vegetable-based diet, again, lean and green. You must be lean and green. With PCOS, if you're eating a lot of starches, especially in women, testosterone goes up. In men, if they're eating a lot of starches, testosterone goes down. Real important to understand, because I see a lot of young guys with testosterone depletion, and it's all dietary. I changed the diet, they go on Whole30, 6 to 8 weeks later, their testosterone is 200 points higher in a guy. In a woman, you could decrease it, but once you're with PCOS and things are starting, that metabolic syndrome is starting, I do use medication. I'll use spironolactone, metformin. You got to shut off the cycle. You don't want insulin resistance and all of that. So the dietary decreases insulin resistance naturally. You want to get your, triglycerides, which is part of PCOS. You want to get that down. But when you get the testosterone down and you control it with herbs and you control it with balancing your hormones and dietary, the other things come down. The insulin comes down and all of that. But again, like PCOS, I take individual cases to say, no, you know what? Don't even mess with hormonal or nutritional balance. You need medicine. And I'll put them on medicine. I'll say we could always change over to nutritional, but you want to correct that fast because they gain weight, they get fat absorption, they're miserable, they have, infertility issues. It's a disease that is definitely controllable and fixable, definitely. And
Right.
PCOS, which is so interesting, when I would lecture, I did a lot of research. PCOS is carried on the male gene. It's hereditary. Not many people know that.
That's interesting.
It's carried
Yes.
from the male. It's very interesting. And the female gets that little bit of the gene, the X chromosome from the male, right? So you have an XY of the male and an XX of the female. It's on the X gene of the male. So that's why it's testosterone driven. Pretty interesting.
Yeah, very interesting.
Mm-hmm.
Lastly, how do we explain, this is a question from a participant, to our spouses that menopause is real?
Oh.
I think that's a nice little thing to end it on.
You know how you tell them? It's really and I'm going to be point out blank, Men and women come in here. The women come in, they're vaginally dry, the men can't get erect, period. So if you want to, as a couple, say, you know what, we've gone through our aging processes. His testosterone's going down, and again, his estrogen is going up, so he becomes more emotional. I just had a case today with a couple with this. The testosterone in us goes up. When we lose our estrogen, testosterone becomes dominant. So we become men and they become women. So you want to try to get them, by the time you're like 40, I would say like the late 30s to 45. So 35 to 45, you want to start talking about, like, let's start to look at our hormones. Let's go to the doctor and look at our hormones, because testosterone is very important for men, for cardiovascular, diabetes, high cholesterol. I mean, hugely important. It's not just about sex. So, but with men, to get them in, and for women, it's going to be about sex. It's like, well, when I get vaginally moist there, like, I'm going to want it. So you better, like, boost up your stuff here, So it really comes down to that, And
Right.
and I think just the knowledge, like, just share the knowledge with each other. Your hormones decline, and you could do something about it. You don't have to suffer.
And speaking, like, for the men, you said about your patients, a man and woman patient had come in, because we do have a great product, right? The Test Up product that you use a lot in your practice for that.
Great point. So men are very stressed, and they're not good eaters. So that's where their stress comes from too, right? They're quick eaters. They eat garbage, mostly breads, pasta, whatever. So their testosterone's going down. test up, will boost up their testosterone, decrease their estrogen. I have a lot of young guys on this. I'm talking like young, because the way you know a testosterone kid has lost his testosterone is that he has thinning hair. So, you know, test up works for that. It balances that with adrenal balance, because again, you have to, like, I use both. And we did probably when MD Logic first came out with that product, it's got to be 7 years ago, 6, 7 years ago. We compared it. We did an independent thing in my practice and compared it with, you know, testosterone by itself, like testosterone injections or whatever by itself, and then the test up and the adrenals. And test up and adrenals, people liked it, and their testosterone came up about 200 points. So it's pretty. It's good. It's really good. But they have to change the diet too.
Oh wait, let's see. We got one more before we end here. My husband just said men's stress comes from menopausal or premenopausal women. That was from one of our last participants.
So true. So true. And I'm so glad that your husband said that, because I've done a talk, the men, the forgotten breed. And men are the forgotten breed. And there was a really good book written about 8, 9 years ago. It said, "Whatever happened to my wife?" Now, you can really, really almost be institutionalized as a woman when you're dropping your progesterone. And this is no joke. No one in the family knows what's going on. The woman feels just god awful. No one knows what to do. So to bring the awareness out at 35 to 45 and catch it and understand it, that yes, my wife's progesterone is declining and I better get her some so I can make it better. Happy wife, happy life is truly, it's a true thing. And it's just devastating. I don't know if I have a second, but I'd like to just tell a story on a woman who was 54 years old, came into my office. She was on 5 psych meds, was in a psych ward, going on her 5th year in a psych ward. This is this is unbelievable. And she came into my office because she was a product of the state, and her mother and father were taking care of her. This woman was a powerhouse of a woman, right? So when she came in and she was walking back and forth and pacing, I said, to the parent, the mother, I said, "When did she first become like this?" She said, "Dr. Carfora, it was 2 weeks after she had that surgery." I said, "What surgery did she have?"
Yeah.
She had a hysterectomy. She had her ovaries out, her uterus out, and went absolutely bonkers. Well, I see this woman, this is years back. She comes in on our anniversary. So the day that she saw me, and she brings me in flowers, she has her life back. And it was as simple as one thing: progesterone. She didn't even need estrogen. She was an estrogen dominant woman who had a total abdominal hysterectomy, who was not put on hormones post-operatively. That is a shame. That is disgusting. Okay, so please, if you have people that have gone for surgery, they were estrogen dominant, got their uterus, ovaries out, please at least go on progesterone, at least, and get your hormones checked.
Right, so true. I mean, we're all sort of going through this together. So it's amazing the information, that's out there that you provided, and how some of these things could even happen and occur. You wouldn't even think of it. But I'm glad to hear that she's doing well now. That's a very happy ending.
She'll talk. I told her she should do a TED talk. She will get up on stage, and she will share her story. I mean, it's
right. That would be very interesting to hear. But with that, we're a little bit over. So that is the conclusion of our Let's Talk About Menopause webinar. If we missed any of your questions, if you have any additional questions, you can email me at jennifer@mdlogichealth.com, and we'll be able to get Dr. Carfora to answer some of your questions. If you want to be on our mailing list for additional webinar updates or any product updates, you can email me as well. You can also check out it's mdlogichealth.com is our website to look at the products and get full ingredients and descriptions for all of the products that we talked about here tonight. And I just wanted to thank Dr. Carfora for a very informative and enjoyable talk. Gave us a lot to think about. I hope that everybody, felt that way about the information that we discussed today, because it is important and there is something that we can do. We just don't have to sort of be sad or, anxious or just kind of, going through life step by step, but really not being happy as we were before, whatever that sort of would mean. But there is help out there. So we're here for you. And again, I want to thank all of our participants for joining us and giving us your time this evening. We'll be sending out a follow-up email to everyone who joined us this evening with additional information if you're interested. And Dr. Carfora, thank you again. As always, you are so informative and enjoyable.
Thank you so much, Jennifer. Thank you for having me.
Thank you, everyone. And we look forward to having you on our next webinar in the series. We'll let you know. We'll keep you posted. Thank you all and have a great evening.
Good night.
Good night. Bye.